What brings you in today to see us, Tristan?
Well, I've always been interested in having bigger breasts, but I'm uncomfortable with the idea of breast implants. So I was looking along online and I saw that you guys offer the Lipo breast augmentation. And I do have a bunch of extra fat that I really wouldn't mind getting rid of. And if I could reuse that to get bigger breasts, it would be two birds with one stone.
We've done liposuction for a long time. That's been around forever. We've done breast implants for a long time. So now we have the ability to combine those two procedures together to treat both areas at the same time and to offer patients another great alternative for breast enhancement. Instead of using implants to make your breast larger, we're going to use all your own natural tissue, your fat that we would typically throw away. We'll just put it in your breast to increase the volume. The process involves sucking out the fat from the areas of your body where you have it and where you don't want it, and we process it, we transfer it into the breast to enhance the volume. And it gives you a much more natural look than, say, implants can, and it feels a lot more natural. You don't have to worry about rupture of the implant, you don't have to worry about infection of the implant, you don't have to worry about encapsulation of the implant that can cause firmness over time. It does have some disadvantages in that you usually can't enhance and enlarge the volume too much in one sitting. Usually maybe a cup size on average at the most with one sitting. Then you can obviously come back another time and do another session to give yourself more volume, which is a disadvantage over implant surgery per se, because you can usually jump at least a couple cup sizes with implant surgery.
A quick recovery time would be a lot better for me.
That's what we tend to see with this type of procedure is that patients recover a lot faster. You don't typically have the same sorts of concerns with the synthetic implant. And you'll probably be able to get back to your physical activities probably within about 3 to 5 days after the procedure. Our goal is not to inject the fat into the breast tissue. We're going to be going around. We're sort of going behind and in front of the breast tissue. The incisions are about the diameter of a pencil eraser, so much smaller incisions.
So it's been 10 weeks now since your surgery. Just tell us how you've been doing.
So, pretty well. I didn't notice any decrease in the breast volume, so I'm extremely happy. The staff was great. They were very inviting. They made me feel very comfortable. They were very informative to make sure I was understanding what I was going to go through, possible side effects. They're just very warm, and I felt comfortable being there. It was very nice to know that I was being cared for so immensely. The recovery was much easier than I thought it would be. It was really easy. There was pretty much no pain after.
How has your feeling about your body changed?
I'm ecstatic. My saddlebags, it's a lot more clean instead of bulgy, and at the top of my hips, it's
More
a
proportionate?
nice curve, and yes, much more proportionate.
Great.
Up to a 32C.
From
like the barely a B. I feel like real breasts.
No
There's
firmness
no
or
firmness, no hard spots or anything like that. It's all nice and soft and real. I'm a lot more confident. I feel better about how I fit in my clothes.